And again, I'm just going to repeat this. Just to reintroduce about myself. Again, I'm Kerry-Ann Joseph-McLean. Corner McLean and I are health enthusiasts. We are not health practitioners. We don't profess to have any type of credential, but what we are, we want to be able to bring awareness to certain things. I know you have a lot of information coming at you and to you through different platforms, but this has been something that my husband and I have considered for about a year, and of course, challenges happened throughout that year, and so it just wasn't the right time. So 2025 for us was for just having an awakening, an awareness. And so in that journey of spiritual awareness, we would be felt empowered to be able to speak about health conditions, health symptoms that have been dear and near to our hearts, that we have experienced in our family and of also friends as well. And in just a conversation, these are topics that have come about quite often, more so than we care for, because, you know, health is part of our life and daily type of experience we have, whether through our eating or mental state or in different types of conditions or workplace or even in your home. Health can impact you in many ways. And so it manifests itself in illness. And so disease is that we call it dis-ease, is when the body is not at ease. And so when we find our body not performing the way that it's meant to, as our creator designed it to be, it sort of tells us, gives us signals, and sometimes we just can't quite put our finger on what that issue is because we're not really medically trained. But of course, we are our best doctors, because if we don't express to the doctors or the practitioners how we're feeling, the symptoms we have, they cannot give us an educated guess from their training through the medical field. Whether it's a traditional family doctor, medical doctor, a naturopathic doctor, a nutritionist, someone who is versed in that area, we have to explain to them what we're feeling. So tonight's topic is on prostate cancer, prostate health. And one of the reasons I share this with you, we've had a few people in our family, both collectively with myself and my husband, and unfortunately, those two led to not too good outcome. But I'll share that with you towards the end. Actually, no, I should share that now. About 2017, my father was diagnosed before I found out that he had prostate cancer, which he hid from us. And so with some urging from his wife at the time, he told us, but he was already in stage 4. And stage 4 cancer in any state, any type of cancer, it's harder to treat. Sometimes, you know, it's not a positive outcome than if you have symptoms that can lead to prostate cancer, or you're in stage 1, stage 2, and so forth. Now, nothing is impossible in God's eyes, but still, you know, we have to be aware. And of course, when you are given this information, or you're told you have a condition, we either move towards trying to get a healthier body, or we go into denial state. And of course, my husband, his brother passed away in 2022, the same year that we had multiple deaths in our family from different conditions. And that we found out 2 weeks prior to his passing. So again, not knowing, and I'll share with you some of the reasons why for us it's become such a hot topic for us, especially in the last year plus. You know, we had to go through a lot of healing process, you know, with the grieving. But when you speak about these things now, you can say without crying, because you sort of process that in your head and in your heart, of course, in your spirit. So what I'm going to share with you, and please feel free to put your comments in the chat. Also, we'll be opening up a Q&A at the end, and that will sort of give you an idea of you know, the conversation that we're having. And to write notes, take screen captures if you wish to, and feel free to know that this is a safe environment. You can ask as many questions as you like. And if we don't have the answer, we will try to get that to you, because we do have friends and associates who are in that field, who are naturopathic doctors, who we can get information from, or we can refer you to. So I share the screen with you. Excuse me, I'm just clearing my throat. Sorry about that. I want to share the screen with you right now. And as I'm doing this, feel free to share this invite with last minute invite if you wish to other people who you feel would be could benefit from this, and as well as if we, if there's additional topics you'd like to speak on, as we have future events, future Zoom calls, you can certainly share that with us, and we can try to compile something to present to our guests. So, as we speak about prostate, what is prostate cancer? And for us, prostate cancer is something that we hear in November. They have Movember, which they sort of bring awareness to. And of course, we as women or men in our family, you have someone in your family who has either had a scare or they actually just want to bring awareness to. So the symptoms of prostate cancer can vary. You can have pain during ejaculation. It could be lower back pain, hips and upper thighs. It could be frequent urination. Now, keep in mind as well, frequent urination doesn't mean it's prostate cancer. It could be, for example, that your kidneys it may not be processing correctly because you may have conditions of or symptoms of diabetes. This can happen as well with frequent urination if you're pre-diabetic or you're diabetic or don't even know that you're diabetic. But here's some of the things that can happen with frequent urination, which could be a sign of prostate cancer. Painful or burning sensation while you're urinating, or loss of appetite or weight loss, and then of course bone pain. You might think, okay, maybe it's age that your joints are hurting you. You may think that, your mobility is not as good because you're not as active, but it could be an indicator of prostate cancer. So these are some of the things just to, not to alarm you in the sense of getting anxiety, but at least to have awareness, right? So I also in place in my presentation some of the source websites that I found some of the information through. And so for me, it's important that we build awareness for that. So some of the common symptoms of that, as I mentioned before. Another one is erectile dysfunction. Erectile dysfunction could be an indicator of prostate cancer, but also erectile if dysfunction can happen if you're diabetic or if you're taking diabetic medication that can cause that to happen, or your insulin level is too high. Because these are some indicators as well that I've actually learned along, with our family as well as with searching for information when my dad was diagnosed with prostate cancer. Another one is fatigue. You're extremely tired, and you find that your sleep pattern is off and you're sleeping and waking up, especially when you have to have frequent urination. Another thing as well, the common sign of prostate gland enlargement, which may not be a prostate cancer, but it also impacting your prostate, is the enlargement of the prostate. Some of it would be your weak urine stream, difficulty starting to urinate, dribbling at the end of urination and frequent urination, and urgency to urinate. So those are some of the things as well. And I'll share with you this because, and again, this is hindsight. My dad, when he came from my sister's, my younger sister's wedding, way before he passed, he couldn't keep he couldn't keep his urine. As time he pulled up with the driveway, he had to go, but he didn't express what he was going through. And so we just thought it was part of age and not putting two and two together to realize that something's not quite right. So he had another issue with his foot, which I took him to the doctor, which was corrected and healed, but he never mentioned that this was something he was going through. And so, if you don't express, we don't know, we can't guess. Same thing with your doctor, right? So much less your family member not realizing that something's not quite right. So again, please, 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 for those of you who are seeing symptoms or signs in their loved ones, have them checked and screened. So prostate cancer can impact different ethnicity. It can impact your, can be factor with your age. It could be your obesity. as not everyone goes through prostate issues, but of course it's a higher risk. Your diet, inflammation in the prostate gland and sexually transmitted infections, or even vasectomy. There are risks that can happen if you've had a vasectomy as well. And so what are the symptoms of a prostate dysfunction? So as I mentioned, she was speaking about prostate cancer, but overall prostate health. So I'm just sharing with you some of the signs and symptoms before I express to you some of the things you can do to improve your prostate health. So I mentioned this before, but one of the things that for me that of course being female wasn't aware of, there's also one of the indicators are that there's blood in either the pee or the sperm. Discomfort and stiffness in the buttocks, hips, or the upper hip. Those could be indicators as well. And of course, difficulty achieving orgasm. So I'm speaking this in a way where, we talk about these things lightly, or sometimes we don't talk about health in this capacity because it's sort of like a cliche. They don't speak about certain things, especially to male, female, in a home or amongst friends. But these are the symptoms that we sort of put under the rug in a sense, and sort of feel sort of embarrassed or bashful to speak up, especially when you're not taught or encouraged to speak freely about your health unless you're actually having severe pain or symptoms, and that stage it might be too late. So I'm actually going to go through every single line of this, but you can take a screen capture of this if you wish to. One of the things I wanted some of the things I wanted to highlight to you is urinary incontinence. That's the blockage of the urethra. That happened to my dad. And that is when his wife actually encouraged him to call us. He lived in the Caribbean in Antigua. And so at that time, he had difficulty urinating. And of course, he ended up having a blockage and wasn't able to do a proper urination, and was much more painful. So another thing is urinary retention. And another one is urinary tract infection that can happen in men. Sometimes you have a catheter, or you have some type of surgery, and that can cause the prostate problems to develop faster than normal. Another one too I want to mention to you, I spoke about different stages of prostate in the beginning of the conversation, and one was I mentioned if it's stage 4, it'd be harder to treat, or sometimes there's no turn back, there's no way to come back from that. But if, for example, is through your screening, your testing, the way that you need to be able to identify if you're high risk of prostate cancer, here are some of the things you can find at stage 4. So during stage 1, stage 2, stage 3, they're like small indicators of what's happening. But then as the prostate actually advances, more symptoms will present itself. Shortness of breath and chest pain is one of them. Fatigue and weakness, rapid weight loss, headaches, dizziness, seizures can happen, where it can spread to the brain. And I mentioned that this one especially because my uncle who lived in the US, in Los Angeles, he had prostate cancer, was in remission, did his chemo, radiation, but unfortunately came back, and then it spread to his lungs and his brain. And so this happened over a period of time, in a short period of time, where it moved from stage 1 to stage 4 in a couple of years. And unfortunately, he passed. And this was my mother's brother, who shared the same birthday. So another thing is what abdominal swelling or jaundice, which can happen, because it has spread to your liver. So these are some of the indicators that some people may sort of brush off or say, okay, it's something else, or they may feel fear in going to the doctor to express what they're going through. And I want to mention to you a couple of things, and I sort of jumped the gun with sharing this information to you. Here's a picture of where the prostate is, in the male organ body. And then of course there's some things that I'll come back to this slide in a second, but I want to share with you some of the findings that I've actually with my research found that can help. Now what you see here is actually a superfood that's considered a two categories: medicinal mushroom as well as medicinal and nutritional whole food. So it's actually considered a whole food supplement as well as medicinal mushroom. And so this is some of the findings I found through PubMed.gov. You can take your own time and actually go do your own research for research, but there's over 3,000 case studies of this actual herb, which I'll come back to in a second, and I'll share with you some of the findings. I'm going to skip this and come back. So some of the diagnosis of prostate cancer, it's for what we would highly recommend is PSA testing. Some parts in the world you have to pay for your testing. Like in the Caribbean, what I found out from my dad is, for every appointment you have to go to, you have to pay $200 in their currency per visit. We're here in Canada, we take it for granted, but it is actually part of our program and our health program. But in other countries, you may have to pay. But it's important that you have your testing done. Another one is DRE, which is digital rectal examination. Now, in my culture, there's actually a taboo. I'm not sure why. A lot of people just think that that's something that you don't do as a man. Because of fear of maybe homophobia. So one of the things is that these things, people will go through the pain and choose not to go to a doctor to have it checked because of fear of XYZ. It could be fear of doctors, it could be fear of, like I mentioned, homophobia, it could be fear of many things, but this is something that could be life-saving. And so when you have these tests done, it can impact your life in a better way, in a good way, because you're actually being proactive with your health. Another one, I want to share with you a couple of tips that we may take for granted. And one is eating healthy diet. Sometimes you go to the processed food and not eating a well-balanced diet because we're sort of in a rush and going through our life. Another one is to avoid high-fat dairy products such as spicy foods or excessive caffeine intake. What I found in my research, which is not in the slide, is that a high level of caffeine content can be found in energy drinks. So younger and younger males are experiencing prostate imbalance in your readings, or higher risk of prostate cancer, because they're introducing caffeine drinks, highly caffeinated drinks, energy drinks that can actually tip the scale to an imbalance level of your blood work with your PSA. Another thing too as well is wearing comfortable clothing. Some people wear tight-fitted clothing or underwear that actually can impact, just like how women are supposed to wear tight underwear, tight clothing for their reproductive organs. Same thing for men. Strengthen your pelvic floor muscles. I'm smiling at this one because I actually do see my husband doing this particular exercise from time to time, and he's way more flexible than me. So strengthen your pelvic floor muscles, not only for women, but also for men. Drinking plenty of water and choosing the right herbal supplements carefully that can align with your body and help your body become more into wellness state. Making cardio a priority is also very important. You're having the right balance for your body, because you could be going through other things that you cannot do excessive amount of cardio, but at least you can do some walking 15-20 minutes a day, and then of course increase it as you pay attention to your body. Managing your stress level is super important as well. Your stress level can impact not only male who have a high risk of prostate challenges or health challenges with prostate, but other things as well, because stress sort of manifests itself in different ways. Like, in women, it could be different things. It could be on the skin, it could be the hair, it could be your cells, it could be anything in your body. It just actually presents itself in a different way. Some people go through anxiety, depression, stress, but there are other underlying things that can actually trigger stress level. Now, there's manageable stress, which can happen day to day. You get up, you're rushing, you're going to work, you're coming back home, thinking about what you're going to prepare for your family. But having a high levels of stress in your body is not going to stay inside. You'll find you'll actually have, the body says that's it, and it actually manifests in illness. So another one is avoiding sauna or hot tubs. A lot of individuals may want to have that because it is said to be therapeutic as well. It helps to detoxify your body, but too much of a good thing sometimes can be a bad thing. It's also limiting sodium intake. I would say to you, read your labels, see what's in your seasoning, in your packaged meals. Sometimes you want a lot of takeout. So the takeout may be type of sodium that's not good for you. Things like Himalayan salt and that some have heavy metal. See where the sources come from. Some have like iodized salt that's actually not good for your body. So find the salt that will help you to get the right nutrients, but where you find that the sodium intake is not so high, especially if you have frozen meals that you're going to heat up on the go, things that have a higher risk of you having too much sodium in the body to bring an imbalance into your body. So eating a healthy diet could mean avoiding some foods. Consuming foods that are high in your diet, like vegetables, fruits, whole grains, and lean proteins and healthy fats, you can incorporate those. Now, as you're preparing your meals, one of the best way I can suggest is what I did for myself and my mom, my family, is prepping meals, let's say on the weekend. Preparing, seasoning, doing all what you can do, label them, and then you can have a week or two of food prepped so that you don't have to overthink it. Will help you in reducing the bad things in your body that you consume and increasing the things that actually help you with your overall well-being. Another one too as well is to watch out for food that are very high in dairy, high fat, like processed meat and the red meats. Their actual medical scientists will recommend having meat once a week. Some people have it 3 or 4 times a week. Avoiding spicy food, limiting how much of spicy food that you like. Now, for me, they may laugh at me because they tell me I'm a Caribbean girl, but I don't do a lot of hot, spicy food. I eat a lot of seasoned food, but not overly spicy. So this actually can irritate your bladder or your colon and can be problematic for your prostate. Now, another one too is limiting or avoiding caffeine, alcohol, and sugary beverages. And I will share with you that there are some individuals who have so much caffeine. I have a friend of mine, her husband actually he went for surgery for his knee. And when they actually went to check, his veins were so dry because he was having 10 extra large cups of coffee from Tim Hortons a day. So they actually had to rehydrate his body, postpone his surgery so that he could become rehydrated because he was having too much diuretics in his body. And so balance, again, the body likes balance. And without a balance, it actually works against us. And so we find that, through our health journey, we either have to become proactive rather than reactive. So I'm actually sharing with you a couple to the left. I hope you can see the words a little bit faint. But some of the things that I've known and I'm actually still learning that has helped in different conditions or symptoms are actually pretty good for those who are going through prostate challenges or want to improve their health. I'm going to highlight one or two of these things. One is the reishi mushroom, which I'm going to go back to and show you the slide that I sort of ahead of my presentation. A lot of these provide great amount of antioxidants for the body, which it needs. Psyllium, curcumin, coenzymes, all of these, green tea, vitamin C, D, E, and so forth. But I want to highlight that vitamin E is something that if you've been diagnosed with prostate cancer, something you must avoid. But in this case, this is just some of the things that we found through our research through PubMed.gov, which is a public medical library for practitioners and those who carry out studies and findings on certain types of natural alternatives to certain conditions, or in addition to what you're doing as a treatment that are traditional treatments. Green tea leaf is very high especially for any type of cancer, but for prostate, as we're talking about here, it helps in strengthening your prostate health. And so it helps with your weight management as well. One of the other things I would share with you in the future slides are a couple other medicinal mushrooms that actually have been known to help. So this part I've actually put here as where I talked about the vitamin E. The vitamin E supplement is one of the things that they would recommend, and this came from I think came from the Harvard Institute study. This is recommended not to take vitamin E supplements. And I'm sharing this with you because I had a hindsight moment. When my dad came for my sister's wedding at one point, he mentioned that he couldn't have vitamin E, and he didn't explain further. I thought, maybe it's because he was on blood thinners he had diabetes. I'm not sure why, but I never questioned it. And then hindsight and doing my research, I'm realizing, oh my goodness, that is why he couldn't have vitamin E. He had symptoms of prostate cancer, or me having diagnosed, but hid it from us so well that I know that's not something that you discuss as a parent child unless you probe more. But in this case, it may increase, depending on your genetics, your family history, it can increase the risk of prostate cancer. And so a study was put through where they found um, this vitamin will work against you versus for you. Now, getting extra sun can be challenging, especially if you have melanin in your skin, where the sun, which is meant to protect us at times, can limit the amount of vitamin D we get. So if you're not able to get exposure to the vitamin D every single day or the right amount, because sometimes in the day we're under artificial light, at night, we're home under artificial light. We don't go out as often. We don't walk as much. Or if we do direct sun, it can be a risk. So a healthy balance is also adding vitamin D to your supplements. We call it the sunshine pill, a very tiny pill, but actually has so much benefits, including anti-cancer. It also enhances your mood. But one of the things that we don't realize, especially people of certain ethnicity, like Blacks, Hispanics, and so forth, we are deficient more so than our counterparts in vitamin D, and we do not know because it's not a regular test that is done. When you do your blood work, you actually have to ask for it, especially here in Canada. You have to pay for that particular test. And I did that for myself every time I go for my blood work. You pay attention to your body, pay attention to your intuition, because in my case, I know my mind said, have a test done. I asked my doctor, they asked me why. I said, I just have a feeling. And then I did it, and I was actually deficient in vitamin D, and I started taking vitamin D. But in my follow-up appointment with that doctor, they asked me, why did I ask to have that test done? I said, I just had a feeling. And the doctor said, okay, and that was it. So you're your best doctor. You actually, if you're in tune with your body, mind, and spirit, you're able to identify something's not quite right. And therefore you have a better conversation with your doctor. Getting screened is super important. I mentioned this before, but screening is very important. Do not put off the small signs and symptoms you're experiencing and thinking, oh, I'm just having an off day. The higher risk group of people that actually develop prostate cancer are African Americans, African descendants worldwide, because not just African Americans, but wherever you are, if you have that ethnicity, then of course you're a higher risk. Men with a first or second degree relative with a history of prostate cancer, breast cancer, or females who've had breast cancer can actually, if you've had a history of that in your family, you could have that risk of prostate cancer, colon or pancreatic cancer. Another one too as well is those who are 2 or more first or second degree relatives. So you may have an aunt, grandparent, great grandparent who've had that. It's always good to go back to your family genealogy and to ask questions from your parents or your family, those who are close to you who've had cancer in your family, to sort of eliminate that from your screening when you're speaking to your doctors, or to advise them of. So men who with familial cancer syndrome or have known genetic risk of cancer, those who have certain types of risk factors, there's some tests that are done. Screening is important, of course, and doing the proper blood work to make sure that you have the screening done, including the MRIs and other tests that would be recommended based on the findings or the discussions you're having with your doctor. Another one too is what I want to encourage you is to aim for a healthier eating pattern. Now, it's hard to do, trust me, We start off great and then we fall back to our old habits because we are habitual creatures. The thing I want to share with you is to start small. Start small. If you have a bad habit of, going to the cupboard for certain type of things that are easy fix, or if you grab the bread or you grab something that you just easy fix, easy thing to grab, add to it something that is going to be healthy, like some, vegetables to go with the sandwich, or fruits that will help you, or something that's whole grain, or switching out your white bread to your whole grain. If you can't eat breads, have something else. And so if you're not able to do an overnight 100% switch to healthy eating, which none of us are perfect, none of us can say we are perfectly following our diets, but at least you're making small micro changes that will help you in your overall well-being. For example, if you eat, fried eggs, switch to boiled eggs as an example, or something that we're using like olive oil versus something else. So you sort of keep track of how you're eating and slowly integrate things. So after a period of time, I would say give yourself like a 3-month test, 21 days, 7 days, 21 days, and so forth, so that you can actually have a slow switch to a healthier you. So you can take a screen capture of this as well. Hopefully you'll be able to get a copy of the recording so you can go through this at your own leisure. But you making the decision to invest in your health would be the best reward you can give yourself. So exercising tips for prostate health is, as I mentioned, wearing wearing comfortable clothing, strengthening your pelvic floor muscle, and there's certain exercises you can do that would help you. Kegel is not just for women, also for men. Learning certain types of things that you can do, like yoga. If you're not able to be as flexible or mobile, do things like chair yoga, things that can help you. And as you increase in your strength, you can do different types of variation of strengthening of your pelvic floor muscle. Drinking plenty of water is very good. For me, that's one of my challenges, that I have to remind myself to drink water, more than the average person, because for me, I may have 1 cup of water and lots of other goodness, but I have to remind myself to have at least 5 to 8 cups of water every day. And so for me, to make sure that I'm giving it the right thing. So the main thing is to ensure when you're going to urinate that your urine is actually clear. That's the best way to test if you're eliminating at least some of the toxins from your urinary tract. Limiting alcohol consumption is very important as well. In some cultures, they actually have a lot of alcohol consumption based on meetings and, the outings and so forth, but try to limit as best as you can, because it's also considered a toxin, alcohol. And so your bladder sort of gets irritated from that. Choosing the right herbal supplements for your body carefully. You can actually speak with your naturopathic doctor, or you can consult a person who is into natural medicine, nutritionists and so forth, who actually are certified, that you can actually have the right type of medicinal sort of complement to what you're doing in the way of your health, your habits. There's some techniques you can learn how to distress, like breathing exercise, meditation, doing through relaxation. And that can also help with your overall well-being, including your prostate health. Getting plenty of sleep is important. Now, it's easy to say and hard to do, especially different stages in life and what you have to do in your day-to-day that may disrupt your sleep. But do your best to get about 7 to 8 hours of sleep. And this also is a challenge for myself. Avoid, I mentioned the saunas, because these are also things that can sort of overheat that area. But one of the things I noticed as well, a lot of cultures, they tend to cross their legs a lot for long periods of time, and that can irritate your prostate gland. So in events of the strategies that you find that are not as successful as you like, and depending on your level of prostate health, you may have to undergo surgical procedures, but that would be the worst case scenario. But if you take these daily practice things into place, then these could be a way to help you along your health journey. I'm so sorry. So I want to introduce to you, the reason why I'm sharing this is it's because we're part of a company as a healthier lifestyle. company, health and wellness. And so we want to share with you, I spoke to you about certain type of things you can do for your prostate health, but incorporating other things to help you along your health journey can have a life-lasting health impact for the betterment of you, lack of a better term. And so we have been consuming these products for over 12 years. But there's this saying that I'm going to say this: you can lead a horse to water, but you can make the horse drink. So information I give to you, if you take it, you determine it's part of something that you'd like to be a part of in the way of your health journey, and ultimately the decision is yours. But for me, my job today is to share this with you, to educate you. You may have heard of us, you may not have heard of us, but we've been about for 15 years. And so I'm proud to present to you, what you can do in the way of discovering wellness through our company called Organo. Because one small change can actually lead to a lasting impact for health for you and other generations to come. So the Ganoderma, which I mentioned before, is a superfood. It's one of the medicinal mushrooms on the planet that has a high level of studies done, over 3,000 case studies. So it has become a trending topic for the last 8 or 9 years. But there's individuals who will take advantage of the fact that it's a trend and not ethically grow it in a way it's meant to be, like nature. So to the left is our reishi, Ganoderma lindsay. These are names that's been known worldwide in the Eastern and Western world. We have patent protection for the cultivation of it, and we have quality certification over 30 plus. And so as you see, it's nice and bright and red. That's what nature is intended. To your right is actually grown as considered organic, but it's artificially grown, where it looks sort of yellow, not really as mature, not bright, because it actually does not reproduce itself. So it is considered organic, artificially so, but it is because it's free of pesticides and so forth. But the nutrients you get from it is way less in percentage than what you would get from ours. The 3 actual herbs I want to focus on are mushrooms, Organoderma, cordyceps, and lion's mane. And these 3 actually work in unison or by themselves. And so for myself and my family, we consume this. For those that we share with, they consume it and we get great feedback from them. And so there's a lot of information I won't go through. I just want to share with you these 3. Here are some of the findings for the Ganoderma I mentioned before. It supports immune health. It actually helps with a better mood. It aids in longevity, and it helps you to fight. Basically increases your strength, your libido, all of that. But in this particular discussion, we're talking about prostate, but there are many symptoms or conditions that are associated with prostate, and one also is in the therapeutic dosage that's provided to those who are experiencing these situations. If you're taking chemo or radiation, in certain parts of the world, you can actually consume Ganoderma in conjunction with your medication because there's no known side effects. So it's known overall to help and prevent or treat certain types of disease, but it's known mostly as well for anti-cancer properties in not just prostate, but other things as well. And so cordyceps is another one I mentioned before in the 2 slides before. I mentioned before that with prostate issues, symptoms, one of the things could be endurance. It could be your performance. It could be many things, take your stamina. It's not just for that area I speak on, the prostate cancer, but overall, not just for men, but for women as well. And so it helps with many things like anti-inflammatories. If the body's heavily inflamed, it's not going to perform the way it's meant to. I mentioned before that with prostate health that you can have a decrease in appetite, your longevity, your libido. This actually helps. So in conjunction with the reishi or the Ganoderma and the cordyceps, these are things that can help your body. We do have the national product number with Health Canada, and that states that it supports your immune system for the Ganoderma, but is known to help with many other things as well. As I mentioned, there's over 3,000 case study. Another thing I want to mention is the lion's mane, which wasn't part of the findings for prostate, but in some of the challenges you go through, especially when you're going through radiation or chemo or some type of stress of the body with prostate health, it can impact your memory as well. So the lion's mane is known to help with your focus and concentration as well, with your cognitive as well as your gut brain health. These are actually some of the products we have. I mentioned before, one of the things to sort of limit or stay away from. As for the findings, is coffee. Now, again, coffee is habitual. Teas are habitual. Growing up, that's what you drink. Whether the weather is hot or cold, you consume these things. So even though you're going through your challenges, your health, you will find yourself gravitating to a coffee or tea. The individuals who are heavy smokers, they know they're going through, cancer, but they'll still go out to have a smoke. I witnessed this with my cousin who went through breast cancer. I took her to all of her radiation appointments. And those who were in the cancer treatment, right after, they would go outside and have a smoke. So it's habitual. So why not consider, if you're a coffee, tea, or hot cocoa lover, to switch a brand that actually helps your body get it back to a wellness state. Now, keep in mind, the coffee, teas, and hot cocoa are not what helps your body. It's the Ganoderma. Infused into all of these products is the beautiful Ganoderma. And in some cases, you may have the reishi as well as lion's mane and cordyceps. But if you lean towards a cup of black coffee anyways, you could try this and see what it does for your body. So for us, we consume this every single day for the last 12 plus years. And what we love about it is that you're consuming something you love that your palate likes, and you're getting the goodness from every cup. And the reason I said that, for me, if you're like me, I mean, we know bitter things actually are good for you, but once it past my palate, I will not take it every single day. Maybe once or twice, but then I will not continue taking it to get the right healing or help for my body, because my palate won't pass my palate. But what if you could drink something that you like the taste of it and still get the benefit of it? Keep in mind the Ganoderma, if you were to make it into a tincture, it's very bitter. If you can think of things like, we call this, it's called cerasee, or other type of bitter bark or bitter leaves of bitter tea, they're good for you, but you won't drink it every single day for years to come, right? The fact that you're consuming all of these things that are good for you, why is you going through your health challenge, or you're trying to be proactive, you're giving your body what it needs, and it's benefiting, because the body will not lie, it tells you exactly how it feels. So I want to share with you the comparison. I shared with you the artificially grown Ganoderma. It actually, into your body, it absorbs between 4% to 13%. That's the ratio. For ours, which is the naturally grown, that's protected by our patent, it stays in your body, absorbs 99.9%. And this is the spores, the three ways that the Ganoderma is grown. And it stays in your body, and you don't actually, I would say the word pee it out of your body, right? Because sometimes you take vitamins. When you take your vitamins and you go to the bathroom, you may see the color of the vitamin. But if you actually, that means your body's taking what it needs and then pees out the rest. But with this one, with the actual food supplement, or the way how it's considered as a therapeutic dose, it stays in your body and then takes out the toxins from your body the natural way. So the Ganoderma is grown into 3 stages. It is the root, which is the under the earth, the fruiting body, which is the main part of the body, which we have in most most potent as to what we've been advised of through the naturopathic doctors and other findings. The spores is the most potent. It's actually 17 times more powerful than the rest. So for me, I like the spores, but I still like my coffees and tea. But you can be the best judge of character in the way of how you actually consume it, what it does for you, how you like it, and how your body responds. So we actually have a promotion running up until March 31st. There are a couple of wellness packages that you can actually try at your leisure, consume it, share it with your family, and then from there you can determine which one of the flavors you like the best, you gravitate to. Now, there you can buy actually a product that is a single item, like the strictly black, or if a blend of different types. You have certain things that have, for example, Cafe Supreme that has ginseng, Tonkat as well as the reishi. And you have the Royale, which has the blue packet, which has the Ganoderma, you have the cordyceps as well as the lion's mane. So what you gravitate to is what you actually would want to sample, sorry, to try and to taste and see how your body responds. There are different types of packages here that I will share with you. But one of the things I wanted to express to you is that this additional way you can have more savings. We do have a program where you can save 25% every single month based on your needs as what you like to consume. And then from there, you get that additional savings, but you can speak to the person who invited you and we can express more how you do that. So thank you for coming along this journey and discovering the wellness with Organo. And as we go through all of this, I have this last slide I want to share with you. It's a part of a journey that we're on as well on health and wellness. We were invited to be part of 2 magazines and one coming for this month coming, talking about our journey, how we transitioned from corporate to health and empowering people through our health journey, sharing health with other individuals. And of course, to our left is the Women's Journal and CEO Weekly to our right. Feel free. We have the links to the articles that you can read up on in details. I can add it to the chat here as well. But with that, I'd like to open the mics for those who may have questions for me. Feel free, and please feel free. This is a safe environment. You can ask the questions, and of course, we will try to answer as best as we can.
Good night. Good night. My name is Andrew Richards. Your husband invited me. I'm the guy who was behind Boots No Heels.
Oh, hello.
Yeah, but I'm at work. My shift is almost over. Sort of he told you that I've been going through prostate cancer. I did surgery, radiation, and now I'm just doing all my follow-up. My next one will be June.
I'm very proud of you. Very proud to hear you doing that because in all people, so thank you.
Yes, I've been doing fairly well, I believe. I'm in the gym, you know, I'm eating, trying to eat right. By the way, you mentioned something about something else instead of the coffee. I know my wife been telling me to leave coffee alone, but you know, I'm an emergency, so I have to have something in the bowl.
Yes. I understand.
So I would love to get some more information. What's the difference or the benefits with this product instead of?
So what I can share with you is that, what we have is coffee, right? So this coffee, tea is hot cocoa. But what the great thing about the Ganoderma is it neutralizes the negative effects of the caffeine. So for example, in most cases, it won't spike your blood sugar, it won't spike your blood pressure. It's not a diuretic. It rehydrates your body because that's what the Ganoderma does. Most coffees or all coffees in the market, because they're diuretic, you drink too much, the body sort of reacts in different ways. Coffee in a whole has some benefits, but then the benefits and the pros and cons sort of, aren't balanced. But if you infuse that superfood into it, you will find that your body gets what it needs. So for example, as you're drinking a coffee, I would say switch the brand, try it for 30 days and see what it does for your body.
Okay. All right.
Yeah. You're very welcome. And congratulations on your journey of where you are right now.
Yes, I think I'm doing fairly well, and your husband could tell you I use my platform to encourage other men, especially Black men, to do their checks, stick with it, and you'll live long.
Very good. I commend you for that.
Yes, ma'am. Appreciate it. So I will talk to him off here because I just have about 5 more minutes before my shift is over.
Not a problem. He didn't quite tell me everything, but thank you for sharing. I appreciate it.
Anytime. And have a great night. And I will talk to him off it. All right?
Okay. Take care.
You too. Take it easy.
Any other questions? I'm just going to check the chat here.
Good night, Kerry-Ann.
Hi, Maria. Good night.
I have a question because I have boys and I have my oldest one's 28. So, what age should they get checked out?
Well, according to what the findings I found through Harvard, the Harvard study, as well as other clinics, they normally do a screening. It depends on the family history. So if there's a history of cancer, they want to make sure they check certain levels. Blood work is one of them. So when you speak to your doctor, you just let them know, there's on both sides. Your kids are two types of ethnicity in Black and Hispanic, right? Spanish, sorry. And so there's a chance they may have been some kind of history. So check with your doctor, find out. And then from there, they keep that as to what they recommend. It could be early, it could be late, because there's some younger people, 19 and 20, who have developed prostate cancer, but the screening is much older. But if they're still checking through the history, then you have to push for that, because then they may just brush it off and says, yeah.
Okay, thank you.
Yeah, so
Checked out.
no, hopefully everyone was able to join. And if there's any challenges, because last week we had a challenge with logging in. I'm not sure why that was the case. If there's anyone, let me know, send a message, and I can certainly forward the recording to them as best as we can. Keep in mind we have discussions every Tuesday. For this week coming, we're going to speak on inflammation. And so that inflammation is not just, certain areas of the body. It could be the brain and the body as well, right? So we're going to speak on that. Again, if there's any other topics you want to talk on, please feel free to chime me, send me a message, and we can put something together. And so last call for questions. Okay, then. Have a great night all, and you take care. Bye-bye for now.
Good night.
Bye. Thank you, Kerry-Ann.
You're
Very
very
interesting.
welcome.
Okay. Bye-bye, everyone.
Bye.
See you later, alligator.
Take care.